I'm joined now by Anne Flynn of Save the Eighth, who's Assistant Director of Nursing at a major Dublin Irish hospital, and by Dr. Katrina Henshin, Medical Director of the Irish Family Planning Association. Katrina Henshin, doesn't it stand to reason that if you make it easier to access something, more people are going to use it, and therefore we can expect the Irish abortion rate to rise if the Eighth is repealed?
OK, I think first of all it's important to reiterate what was said on that little clip, that abortion is a reality in Ireland. Irish women do have abortions. But in terms of evidence that's there, whereas it might feel that it would be logical to think that, the evidence as provided by the World Health Organization is that in countries where abortion is legalised, the number of abortions does not increase. And that's a global trend. That's across all of countries.
But isn't there a problem? I mean, we saw about the Portuguese example there. By definition, if something is illegal in a country, you're not going to have very good statistics about how many abortions are being carried out illegally. So therefore, it's a bit difficult to say with certainty that the rate has gone down.
No, and that's probably why, as was seen in that initially what you have guessed at as the rate and what the real rate is are slightly different. So initially, it may appear as if it actually slightly goes up and then over time comes down. But it's only going to come down if there's a certain type of service available. So if you have an abortion service that's linked with good contraceptive care, that you also invest money in comprehensive sexual health education, that you also invest money in free, readily accessible contraception across the population, that's the only way you're going to see the abortion rate come down.
But that could be done whether you have legalised abortion or not, presumably. Absolutely,
and we have been asking for that to happen for a very, very long time.
Anne Flynn, the one thing we can say for certain about the abortion statistics in Portugal, for instance, is that they may have gone up, but they have been coming down since. So doesn't that suggest that there is at least some prospect that the number of abortions here would actually decrease after the 8th, if the 8th is removed?
No, I think the difficulty with the Portuguese figures, it was introduced, abortion in Portugal was introduced right before the recession, and they believe that the statistics were affected by the recession, that people felt they couldn't financially afford to have another child and expand their family, and that's why the statistics rose. And now they're coming back down, but they're now down more or less at the level that they were at, give or take, you know, as we saw there in the clip, about 1,000 than when it was actually introduced.
But they haven't gone up dramatically, is the point.
Well, I suppose they haven't gone up dramatically, but they were double or triple what they were before the abortion was legalised, when people were travelling to Spain.
Well, we don't have firm statistics for illegal abortions, and I think so we can't really say.
And I suppose I think that's the issue that we have here, that the government haven't invested in doing any sort of a feasibility study in relation to the abortions and the potential for abortion numbers. An independent actuarial study conducted by Brendan Lynch and Anne-Marie Gleeson, two independent actuaries, have conducted a study, and they've looked at 7 Western European countries, including Portugal, and looked at their numbers, and many of whom have more conservative regimes than what the government are proposing to bring in here. And they estimate independently that the abortion rate will increase by 5,300 a year. Should abortion be brought into Ireland. That's an extra 100 a week, 14 a day. And the other thing that has to be remembered, and it hasn't been put out there to the public, when we look to the UK, 40% of all abortions under 12 weeks are surgical abortions. So even looking at our rates now that we know of with women travelling and the women taking the pills that we're told are taking pills, that's an extra 2,000 surgical procedures that our health service would have to take on board, and our health service can't take that.
Katrina Henshin?
First of all, I would say we shouldn't always look at England for all of our statistics, and in terms of numbers of surgical abortions, the numbers of medical abortions are much higher compared to surgical abortions in, for example, Portugal, or even, if you want to look closer, in Scotland. So the proposals that the government has put forward are of a predominantly medical abortion, primary care-led service. So it shouldn't lead to all of these surgical abortions that you're talking about. It should instead allow for practitioners, and lots of doctors have signed to say that they are in favour of repealing the 8th Amendment and will be available to offer services. So If you have primary care delivered services, it can be done in a much more cost-effective way.
I suppose I'd say less than 5% of doctors have come out and have supported repeal the 8th. So that's potentially 95% that aren't. I suppose I work in the acute sector, and I work at the coalface, and I have done for the past 28 years. And I know that there are many, many healthcare workers who will not participate in abortions. And the difficulty that we have here, we're talking hypothetically. You're talking about it should be GP led. It should do this. It should do that. There has been no feasibility study. Simon Harris, Simon Coveney, Leo Varadkar, supported by Micheál Martin, are bringing in this repeal blind, and they're asking the Irish people to vote on it blind, with no impact on the health service. No, where is it going to be performed? You know, who is going to partake in it? How much is it going to cost? How many are going to be involved? There has been no feasibility study done.
Okay, just to, sorry to bring it back to the numbers just for a second. I mean, the example of Britain is frequently mentioned, and yet we do have a different culture to Britain, and you can see that in the divorce statistics. If you look at the raw divorce rate, it's about a third here of what it is in Britain. So it surely doesn't necessarily follow that we would have similar rates here as they have in Britain.
We see people often quote the divorce rate, but back in 1990 there were 40,000 separated people. Today there are 285,000 separated people in Ireland. So that's a sevenfold increase. Now, I'm not suggesting that the abortion rate is going to increase sevenfold, but it does have an effect. And when you introduce something like abortion into a country, into a society, it changes the culture of the society. It becomes the norm. So now, when a woman experiences a crisis pregnancy and she goes to her doctor, she goes to her nurse, she goes to her family and friends, now abortion is the last thing that would be mentioned to her, if it's mentioned at all. Whereas when you have it and it's culturally acceptable and it's culturally the norm, it is the first thing. The first thing that would be said to that woman is, are you going to keep it? So suddenly, you know, it becomes the first port of call as opposed to the last.
Okay, well, first of all, I'd like to say that unfortunately in Ireland at the moment, when women go through crisis pregnancies, they don't turn to their doctor, they don't turn to their nurses, because they don't feel able to actually disclose the information if in their head there is even a thought that they might not want to keep it. Instead, they either access no services, they sort everything out for themselves, and they make those decisions, very difficult decisions about whether they're going to keep a baby or not, in the circumstances where they're also trying to figure out, can they afford to travel? When will they be able to book their flights? Who's going to look after their other children while they're away? What are they going to say at work? What story are they going to have to invent to cover up this terrible, shameful thing that they're being asked to do? That is not right, and that's not the right way to be making that decision. That decision should be made in the calm of a proper doctor-patient consultation.
Well, I suppose what I'd say to you, for those that don't travel, or that do travel and have abortions, many more don't. And by making it legal and by making it the norm, it will be the norm, and it will be the first port of call, and more babies will be aborted, and more women will be left having made that decision and having to live with it.
Okay, we have run out of time, but thank you very much indeed, both, for joining us. Miriam.
Thanks.